Now I would like to invite Professor M. VANATHI, and she will be presenting on emergencies associated with advanced corneal ectasia.
Thank you, Dr. Elvin, and many thanks to Dr. Bhavna for putting across this wonderful session, and thank you, ma'am, for making me part of this session, and happy and privileged to be in this session of AIOs. I would be taking you on for the next few minutes through emergencies which are associated with corneal eye drops. So the common ones, or the ones which you would expect to tackle when you're looking at corneal eye drops, is infection, keratitis complicating a case of eye drops, corneal perforations in a case of eye drops, and the occurrence of malignant glaucoma following intervention for corneal eye drops here. I per se have not seen a lot of corneal perforations complicating eye drops per se, but these have been reported in literature. They could be very rare instances, and the perforations which I have encountered is in conditions of keratoglobus or brittle corneal syndrome, where you would find a spontaneous perforation occurring in cases of corneal ectasias here. But microbial keratitis compromising corneas which are affected by corneal edema because of eye drops, that is a reality, and one needs to be careful when you're looking at these cases of eye drops which have not presented on time and the cornea is compromised by long-standing edema. They are amenable to go in for a keratitis scenario here. These are two case examples of corneal eye drops complicating a case of keratoconus and another in pellucid marginal corneal degeneration. So most of us are familiar with the clinical characteristics when we are managing these cases, but what are the particular emergencies which can arise out of managing such eye drops here? We are familiar that the medical management is primarily with hyperosmotic agents and anti-glaucoma agents with a cover of antimicrobial agents to prevent infections. When the eye drops presents to us early on, use of intracameral air or gas, isoexpansyl fluoropropane or sulfur hexafluoride really helps in decreasing the corneal edema and obtain resolution of the cornea in these cases of ectasia. But when you have an intraoperative OCT, it really helps in refractory corneal edema cases. You probably will have to release the intrastromal fluid clefts by using vent incisions on, and that would aid in rapid resolution of the edema in such cases here. Use of intracameral gas, a word of caution in this is when you're using C3F8 or SF6 gases, even the isoexpansyl combinations here, occurrence of malignant secondary glaucoma in such cases can be a rare incidence, but be aware here that if your isoexpansyl preparation is perhaps not really isoexpansyl, then you would land up with a pupillary block glaucoma. You would see a flat AC as in this particular case here, and forward rotation of the ciliary bodies here. And this would then warrant a surgical intervention to release the severe secondary glaucoma in these scenarios here. The modified technique for applying compression sutures in cases of large corneal involvements in non-resolving eye drops here really works and helps in rapid resolution of the corneal edema, where you could place your sutures perpendicular to the long axis of the Descemet's rupture here and combine it with using intracameral air instead of gas, and this is one way of alleviating or of being cautious about the onset of pupillary glaucomas when you're using gas preparations here. So the commonly used intracameral gas preparations is SF6 or C3F8, and the expansyl nature of these gases would lead to secondary glaucoma. And even when you use isoexpansyl gases, and when these have been used for retinal detachment cases, the onset of secondary glaucoma is as high as 6.1% or 18%, depending upon the nature of these gases here. So that's something one needs to be aware of, and that's a word of caution for people who are using. So this is to highlight in particular the emergencies that can be associated with management of eye drops in cases of corneal ectasias. Thank you.
Thank you so much, Professor VANATHI. Nicely covered that a very extensive topic.